Hi, I'm Jordan Soloff.
And I'm Tammy Lovell.
You're listening to The Forgotten Patients, a special report into healthcare inequalities by Digital Health Unplugged.
Finally, the third shift, from the analogue NHS that we have at the moment to a truly digital health service, a health service capable of seizing the enormous opportunities that are there in science and technology, in genomics, in artificial intelligence, advanced robotics.
It's July 2025, and Prime Minister Keir Starmer is announcing the launch of the NHS 10-year health plan. The plan sets out three major shifts, from hospital to community, treatment to prevention, and analogue to digital. His ambition is clear: more online booking, more apps for patients, and more use of AI and data to manage demand. The government says it's the only way to make a stretched health service sustainable and increase productivity. But digital access isn't evenly distributed, and many experts have argued that some people could be left behind. They say that for certain groups, technology could create new barriers and even worsen existing healthcare inequalities. From Digital Health Unplugged, this is The Forgotten Patients, a special report led by me, Tammy Lovell, and reporter Jordan Soloff.
I've never worked with computers and I just don't know how I would use them.
My mother-in-law Rosemary lives in the Midlands. She's in her 70s, recently widowed, and has never owned a smartphone. I wondered how easy she finds it to access healthcare in an increasingly digital NHS.
Really, for me, the thing is, until recently, Alan would always do it on the computer for me. So I would just say which doctor I wanted to see and at what time, and always get an appointment. Whereas now I'm on my own, I just ring up. And if I couldn't, I don't know what I'd do, apart from ask Rachel to sort me out.
Rosemary manages because she has her daughter Rachel living nearby to help her. What happens to the older people who don't have a support network? The National Pensioners Convention represents around 1 million older people in the UK. It estimates that around 30% of its members are not online, plus another 40% would have trouble navigating an online health consultation. We asked Caroline Abrahams, Charity Director at Age UK, about how the shift to digital could affect older people.
A lot of older people aren't online, and even among those who are online, lots of them only use it for pretty limited purposes, so aren't necessarily used to using apps. Even if they've got a bit online, they may not have up-to-date technology, so it might not manage all the functionality that we're expected to use now. Some people are in places where it's hard to get good connection anyway. They may not have broadband. So for a lot of older people who've lived their whole lives without using this sort of technology, it's a bit of a bridge too far.
One of the main problems that Age UK highlighted is a lack of a clear strategy to ensure that older people can access healthcare.
There is an absolutely overwhelming sense from this age group that what people want is a choice. They want the choice to be able to do things face to face or by the telephone or through digital mechanisms as well. What they don't like is being what it feels, I think, often to them to be forced down a path, which many of them either don't want to go on or actually don't feel able to go on. There isn't at the moment, as far as I've seen, I'd be delighted if someone would like to point it out to me, a coherent strategy from NHS England to actually tackle the digital inclusion alongside its shift towards digital and away from analogue.
And it's not just older people who can end up being excluded.
A 2025 report from the King's Fund recommends that action is taken to address digital exclusion for socially excluded groups. Digital exclusion is often framed as a generational problem, a hurdle for people like Rosemary. But when we looked at the data from the King's Fund, the reality was much more complex. We asked Pritesh Mistry from the King's Fund to walk us through the research, and his first finding upends everything we think we know about the digital divide.
So 53% of people who are digitally excluded are in the 65 and over category, but 47% are under 65. So there's a lot of assumptions that if you're older, then you're more likely to be digitally excluded. In reality, it just turns out that there's a lot of confounding factors that come into this. It might be around income, it might be about social isolation, so you don't have the support around you as much as age is.
Nearly half. So this is not just a story about our grandparents. It's a story about poverty, disability, and the barriers built into the very technology meant to help us. Pritesh gave some examples of the kind of people who may struggle to access digital services.
What we are finding and what the research is showing is 37% of people digitally excluded have a health condition which affects their digital accessibility. So digital accessibility and digital exclusion comes hand in hand with health conditions.
And even people who are digitally literate can struggle to access online health services.
We published some work looking at why people are being excluded, and there's examples of people who are very digitally capable, who are deaf and unable to access healthcare services because the healthcare service design hasn't considered them, hasn't created accessibility features that work for them. So they're very frustrated. They have used private services instead of through the NHS, so paid for their own healthcare because that caters to their accessibility needs, whereas the NHS isn't.
So the issue isn't always whether people can use technology, but whether the technology works for them. For those designing digital services inside the NHS, that creates a different kind of challenge. Lee Rickles is Chief Information Officer at Humber Teaching NHS Foundation Trust.
We've got a real risk of creating a two-tier system with health inequalities and the use of digital. And it probably comes down to three things, in my opinion. One, can patients and carers afford the technology? Can they actually, money's tight, can they afford to have devices? Can they afford to pay for the connectivity? The other aspect is, are they competent? Have they had the training? Do they know how to use the technology? And probably the final one is really, are the digital tools we're developing in health usable for the patients? I think without cracking them three bits, we're going to really struggle to get that traction on the last 20%. And them last 20% are likely to be the ones that need it more than most.
Rickles says one of the biggest mistakes digital teams can make is starting in the wrong place.
So, as a digital health professional, don't start with the tech. Just don't start with the tech. Start with how do you operate. Start with the actual users of the services. So systems, professionals, really look at how the service can be improved without technology to start with. Too often we start with the technology as the goal, and we build an ivory tower and hope they will come. But we're not in the field of dreams. They're not going to come. So unless we've got a compelling case of why it improves, why it's of benefit, why it works, the chances are we'll spend a lot of money on something that we get very little value for.
And part of that, he says, is making sure people understand why digital services should matter to them at all.
Have we really explained the benefit to that small group of people? Because they're predominantly the people that receive a lot more access to services than others.
But even when those challenges are recognised, there's another problem. The NHS doesn't always have a clear picture of who is and who isn't using digital services. Last year, the charity Digital Poverty Alliance launched an inquiry into digital inclusion in the NHS and wider healthcare. The research set out to understand how digital transformation in the UK is affecting access to healthcare for people at risk of digital exclusion, including not just older adults, but also those from rural communities and people who have English as a second language. We asked Elizabeth Anderson, Chief Executive of the Digital Poverty Alliance, about the report's findings.
As a charity, we've done quite a lot of work in Cumbria, in the northwest of England. And one of the groups who got involved in the health inquiry, because they heard about it through the outreach work we've done, highlighted that for mothers who are potentially expecting for the first time, they are expected to be able to manage their maternity journey and indeed the early years of their child through an app. Now, some of the parts of Cumbria are incredibly digitally excluded. We see really high levels of deprivation, a lot of low-income families. We see people who have not had access to devices, or where they do have access to a smartphone, it may be shared amongst multiple members of a family. You might have multiple generations living in one home. These are not people who have the latest iPhone that they can just be jumping on. So this then creates real barriers, both for how they are looking after their own physical health and the health of their unborn child, but also the stress that it places on them in terms of knowing that they are not keeping up with the expectations that are being placed on them by the system.
A 2023 report by the NHS Race and Health Observatory found that a lack of coordination was limiting insight into how online healthcare services and apps are used by ethnicity and whether they are helping to tackle health inequalities. That means it's not just a question of who can access digital services, but whether the system can properly see who is using them and who is not. We asked Owen Chinimbiri from the NHS Race and Health Observatory if that lack of data had improved since then.
If you look at the government specifically talking about the 10-year plan and the move from analog to digital, in their equality impact assessment, they have identified that people from deprived backgrounds are less likely to use the NHS app, and that people from an ethnic minority background are more likely to be in deprived areas. So this is something that the government is aware of. But I think for me, the worry is I don't think the mitigations that are in the equality impact assessment go far enough to address those things.
Owen said that even basic ethnicity recording in the NHS remains inconsistent, and in some areas, the proportion of patients whose ethnicity is recorded as unknown has actually increased year on year. When it comes to digital tools specifically, publicly available data showing NHS app usage broken down by ethnicity is difficult to find. Without clear data, it becomes harder to know whether digital services are narrowing inequalities or widening them. There are also questions about whose experiences are captured when digital tools are evaluated.
So that's the other key thing that we need to be aware of. That is, we are moving from analog to digital. Are we getting the feedback from everyone to make sure that we know how other people are being impacted by this? So that how do we make sure that those people either get translation or that they're still able to access healthcare via other ways, not just digital?
In some cases, that feedback simply isn't there. In one evaluation of a cancer app, more than 99% of respondents were white.
So it means that the experiences of people from an ethnic minority background of using that app are not known. It could be a really good app. It could be a really challenging app for them. But because they were not even asked for their opinion, we don't even know.
Not even asked for their opinion. It's here that the forgotten patient becomes a literal reality, because if you aren't in the data, your needs don't exist. If digital tools are designed and tested in less diverse settings before being scaled nationally, those blind spots can travel with them. As more services move online, the data they generate will shape future care. If some communities are missing from that data, their needs risk becoming invisible. And as that transformation accelerates, the question is the system moving faster than it can understand its impact?
The real risk is not moving too fast, but moving too slowly, locking inefficiency into the system while demand continues to rise. And of course, we must always be mindful of the risk of digital exclusion. But the important thing is choice. And we also shouldn't kid ourselves. The NHS is so far behind what patients and staff expect.
That's Health Secretary Wes Streeting speaking at the Institute of Government in January. Some people, like Streeting, argue that progress should not be held back by fears of digital inclusion, and that digital services should complement, not replace, traditional care. But for patient advocates, the key question is whether that choice exists in practice and whether the NHS is designing digital services with the right people in mind. Rachel Power is Chief Executive of the Patients Association.
I think the thing for me around digital exclusion is that we often very much talk about either people who are digitally excluded or those who are digitally enabled. And I think most people are in between. So most people aren't fully digital enabled and aren't completely excluded. And we have that section in the middle that tell us that they need more information and they need more guidance. And to get digital inclusion, we have to design for all three groups and specifically for that group in the middle.
The Patients Association says the scale of digital exclusion is also often underestimated.
I think it's something like 8.5 million people struggling with basic online tasks. That's people with disabilities. That's people who can't afford smartphones, and people in areas where the internet just doesn't work properly. And so it turns out to be much bigger than we might imagine, that digital exclusion piece.
And Rachel believes that if digital transformation is going to succeed, it depends on public confidence.
There's an awful lot of need about trust and transparency. There's a lot of concern about things like AI taking over healthcare, when actually what patients are saying is AI assists the doctor's days, AI assists the healthcare professional's days.
Even if the direction of travel is clear, there are questions about whether the system itself is ready. Katie Hurd from the Good Things Foundation says that one of the biggest challenges is complexity.
The NHS have a target of getting as many people as possible to use the NHS app. For many, that is a massive mountain to get up and over the other side to get themselves onto the app. But then your GP surgery will have a booking app, which works separately. If you've got a condition like diabetes, you might have an app that connects to the smart device that you've got on your body that monitors your blood sugar levels, which is different again. If you change the provider of that device, then you need another app again. And so it's very complex and very difficult to navigate.
For digital teams and clinicians working inside the system, that fragmentation may feel familiar. But Katie says the impact isn't just on patients, it's also on staff.
The other side of this is the workforce within the NHS and the skills that they have to be able to navigate this digital transformation. There are many staff who are unable to use the tools that they are being asked to do as part of the digital transformation. That causes huge amounts of stress. There's indicative evidence that is causing sickness absence as a result. And also people may choose to leave the workforce early because they aren't able to keep up with the technological change. If somebody is struggling with the NHS app, for example, they will go to the first person they can find when they enter the physical health premises. So that might be the receptionist. And if they don't have the skills to help, then we're not moving people onto a position of confidence and skill.
So digital exclusion doesn't just lock people out, it can push demand back onto already stretched front doors. A patient who can't get online may show up at reception, and without the right support in place, digital transformation can simply shift pressure from one part of the system to another. For clinicians and digital leaders, that may be the central tension. The technology is there, but unless digital inclusion is built into services from the start, the risk is that inequalities are not reduced, but redesigned.
So if digital services can create new barriers, what support is there to help people overcome them? The NHS 10-year health plan commits to tackling digital exclusion through training, community support and inclusive design. One example is training on the NHS app, which takes place in libraries and GP surgeries in England. I wanted to interview somebody at one of those services, but despite searching online, I couldn't find one in my area. It made me wonder how easy it really is for people to access this training. My mother-in-law Rosemary told me that she wouldn't feel confident going to something like that anyway because it would be too much at her age. Of course, that doesn't mean that everyone feels the same way, and for some, digital training could offer a lifeline. The charity Out Together runs initiatives in the community to help LGBTQ+ people improve their digital skills. Thomas Porteous from Out Together explained that many older people grew up at a time when being gay was stigmatised and healthcare settings were not always safe or supportive. This could make them feel uncomfortable accessing services, especially when they require sharing personal information online.
It's just about making sure that inclusive stuff is kind of all the way through. You can go to secondary care and you see lots of people wearing rainbow lanyards, but what does it mean in practice for a gay person trying to seek support and help? Often at a time when they're not feeling well, right? So it's much harder to advocate for yourself when you're not feeling well in the first place.
The charity has developed digital inclusion hubs across West Yorkshire, which involve weekly face-to-face meetups. Thomas told us about one of the success stories they've seen at the group.
So Eric's 93 and he comes to everything we run in Leeds without fail. And because of that, he's been able to stay more active, engage with his healthcare better. He had a recent hospital stay, and because of the device he had and that his understanding of how to use it meant that he kept connected with the group and he was able to advocate for himself much better to get that support package in place for him to get home. And I've got no doubt that he would have had a longer hospital stay had he not actually been more digitally connected.
But digital inclusion doesn't just depend on community initiatives. It also depends on how the wider system is designed, including social care. Part of the 10-year health plan involves the creation of neighbourhood health services. The aim is for GPs and community teams to work more closely together around the patient, with a focus on prevention and long-term conditions. Digital tools are meant to help coordinate that care, but when services are spread across multiple settings, navigating the system can become more complicated. Deborah Rosansky, Director of Policy Research and Innovation at the Social Care Institute of Excellence, told us about some of the struggles she's witnessed.
I've sat in my own GP surgery next to an older woman who was really, really frustrated and overwrought, really, about how inaccessible primary care services were becoming for her. You have to submit a request for an appointment online and, you have to have this app and there's another app and it just was very confusing for her. So that's an example that I use of creating too many barriers for simple access to care. We shouldn't be doing that.
Deborah believes it's important that people with lived experience are involved in designing local health and care services.
Sometimes we have a clash between what I would call sort of the medical model of care versus the social model of care. When we've interviewed people with lived experience, what do they want from their services and indeed from technology? The kinds of things that they refer to are about things like staying well connected with other people or, living well independently in their own homes, being able to monitor and manage their own care and support their well-being needs. So these are important considerations, but they may be different than some of the things that neighborhood health is set up to design, which might be things like avoiding hospital admission, things that the NHS is concerned about. So involving people with lived experience in the design of the services will help shape those services around what matters for people.
She also emphasised the importance of staff being properly trained on how to use digital.
It's no good to put things like sensors in someone's home where they're collecting information on a continuous basis, and the staff either don't know how to use the information, aren't empowered to use it, and it's sort of just collecting information without any real impact on people's lives. So making things available to professional staff and family carers is part of the equation as well, and they should be considered super users.
So maybe the question isn't whether the NHS should go digital, but how it does it. Because most people aren't fully excluded or fully confident. They're somewhere in between. As we hurtle towards a digital NHS, the choice isn't between technology and the past. It's between a system that sees everyone or one that only sees those who can log in. Whether it narrows or widens health inequalities will depend on the choices made now and on whether inclusion is treated as essential rather than optional. To the leaders designing the 10-year health plan, don't just build for the ideal patient, build for Rosemary, because if that digital front door is locked for her, then the system isn't modernising, it's failing.
The Forgotten Patients was brought to you by Digital Health Unplugged. For more, follow us on Spotify, Apple Podcasts, or your favourite podcast platform. And to find out about the latest health tech events, news, and issues in the NHS like this one, head to our website, digitalhealth.net.